speaker. So good afternoon from Rome, from the Agency for the Promotion of European Research. We are pleased to open this webinar today. We are the national contact point for Italy, both for Societal Challenge 1, and you will hear in a minute also my colleague Bruno Morenza, who's also national contact point for the program EURATOM. So before starting with the core content of today, this webinar is, as you heard, a specific webinar dedicated both to national contact point, to our colleagues, but also open and to all over you, which has radio protection. My introduction is basically on behalf of the coordinator of the project, Marta Barrionuevo, who's also connected, and we wanted quickly to remind you that Health National Contact Point in all the member states and associated countries, but also outside Europe, are available for all the researchers to guide you through the different opportunities dedicated to health in different programs, and we will see today also EURATOM. We will be happy to organize with you in the different regions or institution information days, as you see from this slide. We can assist you also on a very challenging task, which is sometimes enlarging your network of researchers. So we also take care of partner searches. We can advise you on administrative procedures and legal issues, and of course we can support you through the application process. We are now going to open officially the new call for 2017 for health and for many other programs, so it is a very intense moment. Our project has organized different activities dedicated exactly to the expansion of your networks and your collaborations. The two very first events were in Brussels and in Paris, as you see from the slide, in cooperation with other European projects like Fit for Health or Net for Society. We had a very successful brokerage event last week in Brussels, together with the Information Day organized by the Health Unit. In terms of webinars, this time this webinar is well dedicated also to researchers, as I said, but we are having different topics. In the past we had one on clinical studies in H2020 proposal. We had another webinar on writing successful proposals, including socio-economic aspects. So for those of you who have not had the possibility to participate, it's still possible to hear and access to the registration, the recording of this webinar. I want to remind, as an early last slide, our Health NCP.net website. This is a website dedicated both to NCPs who have access to certain type of information, and as you see from the purple bullet, how to apply funding opportunities, events and calls. We have many information available also for researchers in the health field. One last comment, we have just put online an interactive map where you can access to the national contact point in your country. As you can see, we are all connected in a very broad net all around the world. So I thank you for the attention, and I think I will pass the word to the moderator of this webinar, and next to my colleague Bruno Morenza for the EURATOM project. Thank you.
Okay, thank you for the presentation. And now Bruno will talk about the new CRAU 2020.
Hello to everyone. My name is Bruno Maurenza. I'm the Italian national contact point for health and EURATOM. Today I will share with you some slides regarding Nucleo 2020, which is the European network of EURATOM NCPs. This is the consortium, so as you can see, we are in the partnership. Seven partners from Italy, Poland, Greece, Estonia, Portugal, Czech Republic, and Slovakia. The main activities that we organize, as you can see, as Katerina said before, as an NCP, we can help you on looking for new funding opportunities, in this case in EURATOM work program. We can also inform you about the new possibilities for call for proposals and topics, support on proposal preparation, and also looking for partners. We are also open not only to EURATOM NCPs, in the sense we organize not only activities addressed NCPs, but also research community, like transnational workshops in different issues, for example, legal and financial issues, how to write a successful proposal. So we are not only addressing NCPs, but also researchers. This is a screenshot of our website, so registering, you can be updated on the different call for proposals and also next events, and you can receive also our newsletter every 6 months. You can find also on the section of service to applicants, as you can see on the slide, public documents. So there you can find all related documents, relevant documents regarding EURATOM program. And regarding the partner search tool, we share with C-Energy, which is the European network of energy NCPs, the partner search. So registering at this link, you can have two possibilities, partner offers or partner search. So you can publish your profile, or you can look for consortiums that are looking for partners in order to close the partnership. This is the screenshot of the C-Energy page, the partner search tool. So as you can see, you can also download the work program, the EURATOM work program, and also you can search for partners, the list also of partner searches, and also list of partner offers. So it's very simple. You can you have just to log in with a username and email, and you can publish your profile or looking for consortiums. I leave you the link to our website in which you can register. So this is all from my side. Thank you.
Thank you, Bruno. So now the next talk will be by Andrei Huve and Katerina Patakova from the European Commission, and it will be about the EURATOM work program.
Okay, hello, good afternoon to everybody. My name is Katerina Patakova. I'm here with my colleague Andrei Huve. We are both from the Unit G4 Fusion Energy from the European Commission, from DG RTD, and we are here both because our presentation will be split into two parts. First, I will provide some more general information about the EURATOM work program 2016-2017, and in the second part, my colleague Andrei Huve, he will provide information, specific information on the radiation protection part, on the topic that we call NFRP number 9. So first of all, some words about the context of this work program. Actually, our legal basis for the work program is the EURATOM framework program. It's a separate program from the Horizon 2020. Actually, it's complementing the Horizon 2020 program, and it is a program, it's a framework program which is adopted for 5 years only, because from the EURATOM Treaty we are allowed only to have framework programs, research programs with that specific 5 years duration. So we had one work program and one call in 2014 to 2015. We have selected the projects, and the projects are launched. Now we have this one call. We have also one work program for 2 years and one call, which is now this work program for 2016-2017, and the related call, and this is ongoing. And for the year 2018, we plan to have also a dual work program, and we plan to have one call. And because we shall align ourselves with the big Horizon 2020 program, we are also now slowly preparing the future. So we will working on the prolongation of the framework program by 2 years, and we most probably will also have one work program, the annual work program, and one call for the years 2019 and 2020. So what is the timing of this current work program and call? The call and the work program and the call were adopted and published in October, and now they are open for submission since the 11th of May. And the deadline, the most important date, of course, for you is the 5th October 2016. So what I always say in this kind of events is, please don't wait until the very last day and the very last hours, because the system can be blocked or something can get wrong. So if you want to submit the proposal, please do it as soon as possible, but not wait until the very last moment. So what are just to mention, what are the general objectives of our work program is to reinforce the outcomes of the Horizon 2020 program, and also to support the development of the energy union. And our key features are the safety, enhancing safety in all fusion applications. So it also includes, of course, the radiation protection part. And we also want to give more emphasis on the long-term security of energy supply at European level. Now, in the work program 2016-17, we have 6 main areas of activities. One of them is, as you can see, the radiation protection part. I will not go into the details because the most interesting for you is this radiation protection, so I will not describe the other ones. Just to give you an information or about the budget that we plan for the particular areas and topics is you can see from here. The topic that is most interesting for you is this number 9. So you can see we planned 9 million euro for this topic. Now I put the slide which describes the research and innovation action, which is actually the action which is requested under this particular topic. So I'm not explaining details. Probably all of you know what this research and innovation action is about: to produce new knowledge or to explore the feasibility of a new or improved technology, product, process, service, or solution. And the funding rate is 100%. So the proposals can be funded until fully funded, and you shall have the consortium of at least 3 legal entities, and each of them must be established in a different EU member state or also EURATOM program associated country. Here I would just like to remind you, actually it's also related to this to my next slide. It's a different situation in EURATOM and than in the rest of the Horizon 2020 program. So our only associated country for the time being is Switzerland, and this is valid till the end of this year. Now, what will happen after, it depends on the Swiss government if they will prolong their participation or not. Also, we are now in the process of association with Ukraine. So there is association agreement being signed with that country, but not yet enforced. So for the time being now, as the situation is today, is only Switzerland associated country. But it's up to you also to follow the news and to inform yourself because the situation can change. Now, in the work program, you find other conditions for the of the call. So it's a standard conditions like in the other part of the Horizon 2020. You will find admissibility and eligibility conditions, type of action that I already mentioned, the research and innovation action. You will find, of course, the evaluation criteria, scoring and thresholds, and the procedure for setting priority orders for proposals, and so on. So this is also, I remind usually people to read carefully this part, because like that you inform yourself if you submit a proposal how the proposal is treated afterwards, and how is evaluated, what are the criteria for the evaluation, and how we proceed with the scoring, and so on. Now, what is the indicative timetable? And after, if you submit a proposal, you will get the information from the commission about the outcome of the evaluation in maximum 5 months after the final date for submission. And if your proposal is successful, then we will sign the grant agreement with you in 8 months from the date for submission. And just also, I would like to remind you that the consortium agreement is obligatory. You should have it in place prior to the signature of the grant agreement. So this was all from my side, and now I will pass the floor to my colleague Andreju, who will provide with more details about the particular radiation protection topic. Thank you for your attention.
Good afternoon, Andreju speaking. I must first apologize to wear sunglasses. I have an allergy in the eyes. I don't think it is due to radiation, because it doesn't look like a cataract. I'm going to present the topic NFRP9, which is entitled Impact of Low-Dose Radiation Exposure. First, a few words about the background. So this topic takes into account the previous collaborative research activity by EURATOM. I do not know where to move the slide. Such as, for example, the two projects Opera and Doremi, which aimed at widening participation in research. It also takes into account CONCERT, which is the European joint program on radiation protection, and it takes into account the priority of the strategic research and innovation agendas of the MELODI. You will hear about MELODI by Jacques Répussat after my presentation. So, what is it about? These associations, such as melody, are taken into account for the work that has been done for the integration of radiation protection research. It also takes into account the work that has been done by radioecology, the Association for Research in Radioecology, the Association for Research in Dosimetry, EURATOM, and the Association dealing with research on emergency preparedness for nuclear emergencies. It also takes into account the dialogue that has been established between Melody and 5 European associations in the medical sector, the EANM for nuclear medicine, the EFORM for medical physics, the EFRS for radiographer specialists, the ESR for radiology, and ESRO for radiotherapy and oncology. What is the challenge of this topic? It is to better understand the effect of ionizing radiation, to reduce uncertainties in the prediction of risk. This is valid as well for medical application of ionizing radiation and other practice, such as the nuclear industry, and it also includes naturally occurring radioactive materials, such as radon. It is also the challenge which is stated in this topic to be able to produce science-based recommendations and to also be able to fine-tune the existing precautionary principles that apply to radiation protection system. It will also address the challenge of reinforcing cooperation, thinking that these could be mutually beneficial to all the sectors dealing with ionizing radiation and research in this field. The scope of this topic is to exploit, first collect, but then exploit high quality data obtained during medical use of ionizing radiation. The topic will have to provide a better understanding of radiation effects and also the underlying mechanism. It will have probably to include also molecular epidemiology. It will also cover radiation therapy exposure situation as well as radiology. It will have to use networked and structured data that will also include patient dosimetry, imaging, metadata, and biobanking, which will also have to be integrated with health data, anonymized health data. So the topic states that during evaluation, it will be considered these memoranda of understanding that I have mentioned previously at the beginning of my presentation between Melody and a number of associations, including medical associations. And the result will also have to be presented to relevant stakeholders. It is also mentioned in the topic that international cooperation is encouraged. What is the expected impact of this action? It is expected a better interaction between the radiation protection and medical scientific communities. Working on the same challenge is likely to bring benefit in performing research together. It will lead to cross-fertilization and probably also optimizing research efforts. It will result, hopefully, on a more robust science-based policy. It is also hoped that it will translate into additional or improved practical measures in view of the effective protection of people. This will not probably come immediately, but this is a long-term objective. And also the objective of this action hopefully will be to help avoiding unduly penalizing activity involving ionizing radiation. So you can find more information on the Horizon 2020 web page. I would especially mention a very important document, which is the annotated grant agreement, model grant agreement, on which you find all the information that would motivate questions. I thank you for your attention.
Thank you for your talk. And next, Jacques Depessard will talk about... Oh.
Hello?
Okay. Just a second.
Hello?
Oh yeah, now. Okay. Monsieur Depessard, you can start now. Can you move the slides yourself, or should I move them?
Yeah, I can move them myself. So good morning, good afternoon, everybody. Okay. My name is Jacques Depessard. I'm the chair of MELODY, the European Initiative for Low-Dose Radiation Protection Research. I would like to present you this association and the few points around it. So to remind the auditors about the knowledge gaps which are at the moment affecting radiation protection, the 4 key challenges for research and how EURATOM has responded to this, and finally to mention how this progress can contribute and benefit from the medical scientific community, and also how to organize and optimize national input before a few words of conclusion. So first, we should know that there is doubts about the robustness about the European radiation protection system as very low dose exposures. We're talking about doses well below 100 millisieverts, which is the case for much of the medical exposure, for example. Secondly, there is a big confusion in the public opinion between precautionary-based regulatory system and the actual existence of health risks at low dose or low dose rate exposures. This linear relationship is not understood by the public, who is considering that there are cancer risks also at extremely low doses, although these risks are, if they exist, they are extremely small as well. There is also a poor judgment outside the professional radiation protection sphere about the hierarchy, the prevalence, and the prevention of radiological risks, and this can lead to inadequate risk management decisions. That means also unnecessary costs to industry or the medical communities. And finally, there are unresolved issues of radiation protection optimization, mainly in the medical field. For example, we don't have at the moment good science about individual radiosensitivity. We don't have good knowledge in many areas of the damage to healthy tissues which is associated to radiotherapy outside the tumor, of course, and advanced protocols that have proton therapy, for example, are difficult to promote because of these unknown secondary consequences. So the challenges for research, well, is about closing the knowledge gaps which I've been mentioning, but this is a very ambitious target, and it will require multidisciplinarity. It will need a holistic research strategy. It needs stable funding, and it needs to include also societal aspects inside the research scope itself. So how has EURATOM dealt with this so far? Well, EURATOM, as André Jouve has mentioned earlier, is seeking to improve the radiation protection system for low dose rate, and this has been one of the reasons for the creation of MELODY, to understand better the behavior of effects of radionuclides in the environment and on ecosystems. Alliance to improve radiological preparedness. This is the NERIS platform, and to provide excellence in radiation measurement techniques. This is EURATOM. So these are the platforms which are been mentioned by André Jouve, and also there is, of course, currently being created a sixth platform on the radiation for medical applications. So, and of course, society has also to be helped in its own understanding and interaction with radiation risk. How is this being done? Well, there has been some work done about 8 years ago to formalize what are the overarching questions to science from society with a holistic perspective. This is called a high-level expert group report on low-dose issues, and this is available on internet on the European Commission website for those who are interested. Then we have to develop a thematic strategic research agenda. So this is the main mission of the platforms which have been mentioned. And of course, MELODY and other platforms have already published several issues, and they are revised every year, taking into account the progress in research. These are available on the websites of the platforms. So the website of MELODY is melody-online.eu, and you will find here the latest version of the strategic agenda. There are, of course, the periodic calls from EURATOM, which have been mentioned by our colleagues from the Commission in their presentations. And this is particularly embodied in the projects which have their own internal calls, OPERA, and now Concept. Concept will be presented by Anne-Marie afterwards. And then, of course, we have to EURATOM seeks to create and fund multidisciplinary consortia to operate research. André mentioned about that. The latest call is an FP9 on medical exposures mainly. And OPERA was, of course, acting in having an early involvement of medical research teams. Finally, of course, the analysis of feedback has to be done, and the training and the education is also part of the programs of OPERA. OPERA is a project that will end this year, but Concept is only just starting, and they will address also education and training issues. So as you can see on this slide, This fact it's a kind of matrix approach. On the vertical line you have the different platforms with their strategic agendas and their contribution to research goals. And on the lines you have Doremi, Comet, Prepare, Opera, Concept, and then an FP9 project which has been mentioned inside the 16-17 program. These are EURATOM projects. This is the funding resources which addresses sometimes several, as you see a long line, sometimes only one part of the strategic agendas of the platform. So the funding of the Commission tends, as André Jouve has explained just before me, to actually allow the funding of research in line with the strategic agendas of the platforms. So to come back to explain what Melody is, Melody is a formal association. It has about 50 members, research institutes, universities, medical research universities, etc. In Europe, and they are, as an association, they are governed by a General Assembly and the board. There's a scientific committee on a number of working groups which work on education and training, strategic agenda, infrastructure development, and more recently working groups shared with the other platforms and particularly with the medical community. And then at the bottom you have the projects which are funded and which are operated by the members of Melody or by any other. In fact, there is no obligation to have to be a Melody member to share the EURATOM work programs, obviously. What you should know is Melody is actually formally independent from the European Commission. It's self-governed by its board, which the members elect the board on every year for a renewal of 1/3. It's open association. Anybody can join. The member fee is limited. It's €1,000, and that gives access to all the working groups, in particular the strategic research agenda, which allows the research teams to be aware of what the whole scientific community is doing and to extend the networks of colleagues, and that is facilitation for developing joint research programs to answer the calls. The next few slides, for sake of time, deal with concept, and Anne-Marie is about to present it, so I will skip those and go straight to the Melody SRA concept. So it has 3 key questions which are being asked. First, what is the dose range dependent on cancer risk? That means how much is the increase of cancer risk when you increase the dose at very low doses. Of course, for high doses, we know this quite well. It has been well established after the Hiroshima, Nagasaki, and then all the research since then. But at very low doses, below 100 millisievert, the uncertainties are still very large. The second point is what are the threshold exposures from health risks other than cancer? As you know, that there are systemic risks from high-level exposures and low-level exposures. We know that they disappear at some point, but the thresholds are not very well known, and there is no consensus worldwide about this. Finally, we need to develop reliable methods for identifying individual radiation sensitivity, particularly important for radiotherapy, for example, and also to address related ethical issues. If we understood the criteria which govern individual sensitivity, then we would have to develop for worker protection ethical rules to organize this quite correctly in society. The research paths which are associated to these questions also form into 3 packages. One is radiobiology. That means to understand mechanisms contributing to radiation risk at low level. This is at the level of cellular level or even below. So, and then the next is of course epidemiology. You need epidemiology to integrate the biological indicators which can come out of the radiobiology work into biological indicators which can allow actually the development of risk evaluation systems, including a computerized system, for example, to help hospitals deal with the risk. And finally, you need also some more general research in order to better understand the specifics of internal or inhomogeneous of exposures. A typical case is the nuclear medicine, for example, where the doses, for example, to other organs than the one that is, for example, if you treat a patient thyroid with iodine 131, of course, the iodine will circulate in the organs nearby and through the blood, and of course there is exposure to the heart or to the other organs, and this is not known very well. Well, the research goes on every year. So every year, Melody holds an open workshop, which is a public meeting, which is attended by about 200 scientists. And the next issue is in Oxford in 2023, September 2016. Melody has been promoting the concert project, which Anne-Marie will talk about in a little while, and Melody is a partner of concert. I would just like to mention that Japan is considering launching an initiative similar to Melody. And finally, currently there is this code which André has been presenting, so I will not speak about it again, but it is also, of course, a code which refers directly to Melody research agenda. So a bit more specific about the contribution from the medical scientific community. I would like to first remind that historically EURATOM has been more the field of nuclear research institutes and radiation protection that goes with it for the industry. And the medical societies have been, let's say, using the other fields of European research, but not so much EURATOM. And yet, exposure of patients is today in Europe one of the largest source of exposure of the population. So it does make sense to actually involve the medical societies in EURATOM, and this code is a good occasion for that. So better controlled exposure of patients. The research will benefit from the input of medical societies, from a unique and high quality patient dosimetry data. The dosimetry data which are available, for example, after accidents like Chernobyl, or in many cases from workers, for example, is not known very precisely, and the quality of the patient, of the people's health, if you like, is not as well known as it is in a hospital surrounding. Radiobiology and epidemiology, the research will benefit from medical research and radiation protection science. And finally, imaging and therapy protocols. The research will accelerate the development accessibility of advanced optimized protocols. We should know that in Europe, that today there is no single standard for storing imaging data with the doses to patients, and therefore the research is almost impossible. It is why on a multinational basis, this is one of the big challenges of this new call, to develop a common standard for Europe for the future. As André said also, in 2014 there was this MOU signed between Melody, EURADOS and the five medical societies, and this agreement was formally notified to the European Commission. In this agreement, which is a very simple document also available on internet, the signatories commit to cooperate to promote integration and efficiency of European radiation protection research, to maintain and use of common infrastructures, and to promote scientific education and training. The signatories set up a joint committee and working groups to address this cooperation and agree to develop mutual information. And since then, for example, there has been ongoing informal discussions about the ways to address this new call for EURATOM, and this dialogue has led into the first steps for the creation of a medical strategic research agenda for radiation protection, and the launch of a medical radiation protection platform, which could happen later this year. Finally, so as I mentioned, this is going towards a medical thematic in the EURATOM, and of course one of the issues is to make the questions from society to be made more explicit. What is science doing to develop, support the optimized use of ionizing radiation for medical application of healthcare technologies? For example, vectorized radiotherapy could be promoted stronger if its consequences for healthy organs were better understood. And as I said before, the SRA for medical sciences is currently being developed. There is a first draft already, but it is not, I don't think, publicly available just yet. So we are together working with the medical scientific community, as I said, to work a medical SRA. So there is a working group in Opera and now Concert to develop such an SRA. The link to medical research is will be organized by a medical platform that will deal both with imaging and therapy technologies for radiation protection research issues, acting in close cooperation with Melody and EURATOM. I would like to mention that all the medical associations I mentioned before are already members of Melody and participate actively in Melody's board and in their working groups. And finally, of course, the response to the NFRP-9 EURATOM call, this should be a demonstration project bringing together the scientific communities through the members of the consortium that will be brought together and evaluated by the Commission. This consortium should ideally be a mixture of the research specialized research institutes in nuclear and radiation protection and medical research institutions. So finally, of course, research organizations are in countries. They're not in Europe generally, so they belong to member states or associated countries. And of course, there is a challenge to optimize national input. That means to encourage active participation in the platforms through research institutes, academia, and medical research institutions. I would like to mention, for example, that last year there was a seminar organized in Portugal, and as a result of that, the two leading Portuguese institutions in medical research have joined Melody and are participating in some of the scientific work. So I think this active participation, this promotion at national level is extremely important. The other point that could be mentioned is a national coordination through NCPs, for example, to orient available funding to operate in synergy with European SRAs on selected national priorities. Of course, some countries have their own national priorities of Ministry of Research, for example, but if there is some follow-up at national level of the European SRAs, this is extremely useful to support the national research institutions into the EURATOM program. And finally, of course, each country should consider to accept and even encourage specialization of their research teams in order to reach excellence at European level, because it's very difficult to cover all the priorities of research in Europe, and specialization allows excellence, and excellence is the gateway to win EURATOM calls. And finally, support national research teams and infrastructures to participate in open calls. This is particularly the task of the national contact points, obviously. So as a few words of conclusion, I would just like to mention that with this strategy on radiation protection, Europe is today several years ahead of the US and Japan in radiation protection research. We have today, through this integration process, a very powerful research instrument which is getting more and more operational, and of course research results are expected on the big questions which I mentioned before, which are still today not completely answered. But of course, to reach such ambitious goals, we need the stability of research policies at European level as well as national level for at least another decade. And this stability will also depend on the ongoing support by the scientific communities to the platforms such as Melody. So my final word would to say join, not necessarily Melody, there are others, there's a medical platform, but my advice to research institution, it costs more or less 1,000 euros per year. It is a very useful tool to develop networks and to contribute to the European effort. So thank you very much for your attention.
Thank you for your presentation. So now the last talk for today will be Anna-Maria Schmidt, and I will just open the presentation and then you can start. So Monsieur Represent, can you please press asterisk 6 just for now? Monsieur.
Oh yeah, okay. Great, thank you. Yeah, please start. Thank you.
Good afternoon, Anna-Marie speaking. It's my pleasure to share with you some information about our project Concert. I will answer one quickly asked question right in the beginning. The acronym Concert has developed from the abbreviation Concerted Action for the Radiation Protection Research. So Concert is a European strategy for radiation protection research. It has an umbrella structure which includes a number of radiation protection research platforms in the EURATOM area. Melody platform for low-dose research, the Alliance for Radioecology Research, NERIS for emergency preparedness research, and EURATOM for dosimetry research. As we have heard already, a further platform on research in the medical field is in the process of being established soon. CONCERT is a so-called co-funding act, Excuse me, which means that the funding sorry to interrupt. from the EC and part is coupled from the participating organizations. The overall aim of the joint programming process is to pool national research efforts in order to make better use of resources and to facilitate common European research challenges. It is structured and strategic research. It's a structured and strategic process whereby member states agree on a voluntary basis and in partnership approach on common visions and strategic research agendas to address major research challenges. So now how is this done in practice? CONCERT will launch 2 open research calls. One has been already published beginning of June this year, and the second one will be launched beginning of next year. In addition, CONCERT is carrying out some integrative activities. The open call preparation and implementation is done in 3 work packages. Work package 2 is integrating the SRAs developed in the research platform. This work package is led by STUC and all CONCERT partners are involved. Work package 3 is defining research priorities on the basis of the joint SRA and the radiation protection research needs in the member states. This work package is led by SDK-CEN and all CONCERT partners are involved. Work package 4 is managing the open calls, and it is led by RNR in France. RNR is not involved in any radiation protection research. It's a pure funding agency and therefore guarantees a neutral implementation and confidential evaluation process with regard to the proposals submitted. Cross-cutting themes are dealt with in work package 5, stakeholder involvement and communication of scientific evidence and radiation protection research, led by Public Health England. Work package 6, access to research infrastructures, is led by CEA France, and work package 7, education and training, is led by University Pavia. The overall coordination of the project is done by BFS. This figure illustrates the structure of CONCERT. The horizontal bars in the blue color dealing with call preparation and implementation, the vertical bars in orange color dealing with integrative measures, and the scientific advice on CONCERT activities is given by an external scientific advisory board. The decision-making bodies are the executive board. There we have the work package leaders and the management board with all partners. So who are now the partners?
The concert participants are 28 program managers from 22
Ms. Schmidt-Hannig, can you hear me?
member states.
Can you hear me? I'm sorry to interrupt. Can you hear me?
Yes?
I'm sorry to interrupt. But could you please try to get closer to your microphone because or speak louder because it's difficult to hear.
I am as close as possible.
Okay. Okay, maybe speak a bit louder. I don't know what's wrong because yesterday it worked very fine when we tested it, so I don't know why it's not working now.
It's the same as yesterday. Okay.
Okay.
As I said, we have 28 national program managers from 22 EU member states plus Norway and 4 radiation protection research platforms and 20 so-called linked third parties with a legal link to one of the program managers or linked to one of the platforms. The figure shows the concert participation structure. You can see the program owner, which are usually the ministries, the program managers, which are the organizations carrying out the program, the platforms, and the LGP inside concert, and outside the so-called third parties, which are the universities and research organizations in a call-winning consortium. In this figure, you see that most European countries are already involved in concert. Some of the missing countries and also Switzerland will join soon. Concert is open to new national program owners and managers at any time. It only requires an amendment of the grant agreement. Concert has a total funding of 28 million euro in 5 years. As said already, it's a co-funding action. That means a maximum of 70% is coming from EURATOM and 30% is national funding. The national funding can be in kind or in cash. The EURATOM share is at a maximum 19.8 million euro. The figure shows the concert funding scheme. 60% of the funds is reserved for the 2 open research calls, 30% for concert integrative measures, and 10% for management. The total funding for open calls is 17 to 18 million euro, and for E&T calls and integrative measures it is 2 to 3 million euros. Looking at the timetable, the grant application was in September 2014, and we finally could start in 1st of June 2015. The grant agreement was signed in July 2015 and the consortium agreement in December 2015. The first open call was published on 2nd June 2016 and the second call is planned for early 2017. More details you can find on our homepage. Here you see the 2 topics of the first concert open call. One topic is on the improvement of health risk assessments associated with low dose radiation. And the second topic is on reducing uncertainties in human and ecosystems, radiological risk assessment, and management in nuclear emergencies and existing exposure situations. So this is what I wanted to share with you. Thank you very much for your attention.
Okay, thank you for the presentation. You can see there are a couple of questions now already. So first I would like to know, Monsieur Repoussat, are you still there? Could you please unmute your microphone if you are still there? Okay. Otherwise, we will start with a question. Okay,
This is
great.
Mr. Repoussat
You're
speaking.
back because there are a couple of questions for your talk that participants asked. And though I think we can just start with the first one, which is, can you please clarify the meaning of a holistic research strategy?
Yes, holistic means to consider, well, I would say the other way. There has been a lot of research funded since about several decades, which address very specific issues. For example, epidemiology, to develop bigger and bigger cohorts, or radiobiology to look at, for example, cell exposure, or whole animal models. But there has not been any overall research agenda, if you like, which considers radiobiology and epidemiology combined. So this was one of the big topics of Melodies, to bring together so that, for example, to develop molecular epidemiology which associates in the same research radiobiologists and epidemiologists. Or, for example, as we are trying to do today, to have oncologists, for example, radiotherapists to work together with dosimetrists on the calculation of the research on for medical exposures, together with the radiobiology, all three together in the same project. This is what is meant by holistic.
Okay, thank you. And the second question for you is the research associated with chemical toxicity or actinides, low dose chronic exposure, part of Melody?
This is mentioned in the strategic research agenda, but it is not actively, it's an inactive part, it's not an active part of the program at the moment. We are currently developing a roadmap, so the strategic research agenda is the list of what should be done in a kind of organized, holistic way, as I said. And now we are currently developing a roadmap. That means which topics should be addressed first, and the chemical toxicity is not on the top priority at the moment.
Okay, thank you. I think that were all, for now at least, all the questions to your talk. And though I think now we can go to Ms. Schmidt-Hanig, because there were a couple of questions to your talk as well. So the first one would be, how can the TPs be funded?
Yes, so I think the questions are more or less related to each other. The universities are third parties in the sense that if they participate in a proposal and they will win a project, then they need to be funded 30% by their national fund. So this means 30% in cash.
Okay. And how can universities be funded, and universities that are not LTP and not national representatives?
Yeah, that is the same. Universities have to contact their national POM. You can see it in the call text. There is a list attached with all the partners in concert, so you can easily find out for your country who is the POM, who is the program manager for your country, and this program manager should help you by getting the national co-fund.
Okay. So there's a question coming in that asks, what does LTP stand for?
Linked third parties. So that means these are organizations which are legally linked to one of the program managers or to a platform.
Okay.
So
And so, okay. Okay, and then another question is, some countries in concert are represented by research organizations instead of funding agencies. So how should those countries now be able to participate? Because universities normally do not fund other universities.
Yeah, that is the same question again, more or less. Either you have a program manager in concert for your country, or it will be very difficult to participate. If you have a program manager for your country who is participating in concert, you have to address first your program manager.
Okay, thank you. And then another question is, when is the deadline for Core 1?
The deadline is the 2nd of August. So it's coming soon, very soon.
Yeah, that's true. And another question, is it possible for universities from Romania to participate?
Yes, that is possible. It should not be a problem because there is a program manager from Romania is partner in concert, and Romanian university should approach this partner and then get the national co-fund.
Okay. And another question, who is responsible for Italy at MIUR to provide national funding?
I'm not sure what the abbreviation means. Italy has several program managers, and you should have a look at the list which is attached to the call text.
Okay. And here comes another question. Where can we find the contract details for the program managers?
As I said, in the list which is attached to the call text. And the call text you find on the concert webpage.
Okay. And another question. Is there a help desk?
A help desk for what?
For the call, or here they say, can we ask the help desk exact questions about the participation in EGAP?
Yeah. So you can write an email to concert at bfs.de. But that's also on the web page, and it's also in the call text.
Okay.
Thanks. For us.
Thank you. So I don't see any more questions for you talk, but there came another one up for the EURATOM talk. And this is do participation and funding will differ from those of H2020, and if so, how? Can you hear us?
The question? The question was why EURATOM was an additional program to Horizon 2020, because there are two treaties. One treaty is the Treaty of the Functioning of the European Union. The other one is the EURATOM Treaty, so there are two legal bases. Does it answer your question?
Okay. Yeah, somewhat. Okay. She says not really. um, so we'll just wait, or maybe you can answer the next question while she will maybe clarify her question, which is we are an independent research team inside a university. Do we have to belong to any specific group to apply for funding? And we are interested in NFRP 1 or 5.
NFRP 1. So in principle, any legal entity can apply to any topic provided they are able to make a proposal that that can be successfully evaluated.
Okay, thank you. And now I see there are more questions concerning melody and concert. So one would be to clarify, are open calls and melody and concert, do they obey to H2020 rules or not?
Is that a question for you, Tom?
This is for concert.
So just to clarify, there are no open calls in Melody. There are only open calls in concert, because concert is the European Joint Program. And the calls there obey the Horizon 2020 rules. Yes.
Okay, thank you. And Monsieur Reposat, are you there? Because there was also another question.
Yes.
Where can we find information on the Melody version? Because they couldn't put it on the internet.
The information can be found on the Melody website. It's called melodyonline.eu, and the next workshop will take place in Oxford in the United Kingdom on the second half of September. It's a public meeting, so anybody can come, but we have to you have to of course announce your participation. The organizer is HPE, a health protection agency in the UK. So everything can be found on the Melody website.
And also, could you also please maybe answer to the question about are open calls and Melody, or do open calls and Melody obey to H2020 rules or not?
I would say the same as André said. Melody and Anne-Marie. Melody is an association for to get people to work together. Melody has no own budget to fund research. Melody is a partner of research projects, but it doesn't fund itself projects. And the open calls, which are organized to inside Concert. Concert is an Horizon 2020 EURATOM project, and therefore the rules for participation and for funding belong to Horizon 2020 EURATOM general rules, as André Jouve has
I think
mentioned.
I cannot see any more questions now. So I think, I think then we are through. So I thank you all speakers for giving the talks, and all the participants for joining. And you will be, when we end this meeting, you will be redirected to a survey, a short survey. It would be nice if you could answer that. Just fill it out. Okay, thank you.
Thank you. Can we receive the
yes,
slides that were shown by
we will send the slides out. Also, there will also be a recording of this whole session available later. We will.
Thank you.
Okay.
Goodbye.
Thank you very much. Yeah. Goodbye.
Goodbye.
Okay.